Hello, you're welcome to my channel, your daily health guide. In today's video, we're going to discuss about ulcer, the cause of ulcer, medications, management of ulcer, and the types of ulcer. So without much wasting time, let's begin. What is ulcer? Ulcer is unusual, painful sore that develops in our body system. What I mean is this sore develops in our body system. There could be a special area which this sore could develop. This may be as a result of one or two sickness which result to this ulcer. Now, but the main common ulcers most of the people understand is peptic ulcer. The ulcer that develop in the upper small intestine or the one that in our stomach. So having said that, how many types of ulcer do we have? There are many types of ulcer, but the primary types of ulcer we have are three. Number one, we have peptic ulcer. Peptic ulcer is this type of ulcer that develops in our stomach, developed in the duodenum and in the stomach. The one that develops in the duodenum is called the duodenal ulcer. And these ulcers are often caused by two things. Bacteria called Helicobacter pylori or H. pylori and non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen. Number two, we have mouth ulcer. Mouth ulcer is the ulcer that occurs in our mouth. Sometimes you may see some sore within your mouth here. These are ulcer. This ulcer often sometimes is caused by lack of some vitamins or mouth infections like fungal infections or viral or bacterial infections. So these types of infections often affect our mouth. We have genital ulcer, which is number three. Genital ulcer is the ulcer that affects our reproductive organ. Sometimes you may witness some sore, painful sore on your reproductive organ. This could be ulcer. The ulcer is often caused by sexually transmitted infections. We have three types of sexually transmitted infections which could be responsible for this ulcer. Number one, we have chancroid. Number two, we have syphilis. Number three, we have hips. So these types of sexually transmitted infections often can cause ulcer in our private part. Also, there are some infections like HIV. Once somebody has HIV, what it does is that it beats person's immune system, so it crashes person's immune system. When this happens, it can cause ulcer can occur in your private part because opportunistic infection was set in. We'll talk about opportunistic infection, the infection that occur that when you're not supposed to, maybe microorganism which is not supposed to cause infection to your system, because of this immunocompromised issues start causing infection. So that is another type of infections we have. Now let's look at what are the cause of ulcer. What are the cause of ulcer? Like I said earlier, there are two major causes of ulcer. Number one, which is non-steroidal anti-inflammatory drugs like ibuprofen and aspirin. All those drugs can cause ulcer because they weakening the lining of the stomach. When the lining of the stomach is weakened, it make it vulnerable for gastric juice to cause sore in the linings of the stomach. H. pylori, which is number two, which is the bacterial infections. H. pylori also causes the weakening of the linings of the stomach, which is called villi. When these things are weakened, it makes it vulnerable for gastric juice to digest the area and causes injury to those areas. Now, let's look at the sign and symptom of this ulcer. What are the signs and symptoms of this ulcer? Number one sign and symptoms of ulcer is burning pain. Number one, we have burning pain. Burning pain is the person might experience burning sensations, that is after eating or during the night. Number two, we have heart burning. When somebody have an ulcer, he may experience heart burning here. It may experience heart burning here as a result of injury caused by this microorganism. Number three, we have vomiting, nausea and vomiting. When somebody have an ulcer, he or she may experience nausea and vomiting. Number four, loss of appetite. An ulcer can cause loss of appetite. When somebody have an ulcer, he or she may lose appetite of eating. And number five, we have unexpected weight loss. Loss is one of the signs and symptoms of ulcer. Now, how do we manage this ulcer, which is one of the most important issues? Number one, medication. When doctor confirms that you have an ulcer, he may give you medications, antibiotic for the H. pylori and other medications to get it resolved. Number two, have stress management. When one is diagnosed with ulcer, he or she can undergo stress management like deep breathings, practicing yoga, and other form of exercise that will reduce stress. Number three, dietary change. We all know that some food contain a lot of spices that can spice up the ulcer, that can trigger the ulcer. So when someone is diagnosed with ulcer, he or she is expected to change dietary intake, reduce intake of food that contains a lot of spices like pepper and the rest. And number four, general health maintenance. When you are diagnosed with ulcer, endeavor to undergo general health maintenance. And the last but not the least, always consult your health professional. A regular medical checkup is one of the best ways to get rid of ulcer in your body system, to get rid of ulcer, to maintain or to prevent ulcer in your body system. Having said that, we have come to the end of this video. Thank you for watching. Please subscribe to this channel and turn on the notification bell to get notified anytime we upload video. Bye for now.